Welcome to Balanced Body Podcast. My name is Dr. Brent Anderson. I'm a physical therapist at Polestar Pilates and Physical Therapy Center, and I specialize in Pilates for rehabilitation. And I want to take just a moment to talk a little bit about congruency when rehabilitating the shoulder girdle. And congruency means that you have maximal surface area contact between the two bony surfaces of a joint. So if we're talking about the glenohumeral joint, the humerus, and the glenoid fossa, we want to try to maximize the congruency or the contact of the surface area of these joints. Often what happens is in our daily lives we tend to sit in postures that push the shoulder anteriorly, and we are anteriorly displaced. So when we do physical activity, we often create pathology in our shoulder. Pathologies like a rotator cuff tear, pathologies like impingement or other inflammation processes, tendinitis of the shoulder. So one of our goals today is to show you 2 or 3 exercises that help restore the congruency of that humeral head against that glenoid fossa. So I've asked Jamie to help me out, and I'm going to have her lay on her back. We're going to use the tower bar. And whenever I talk about the tower bar, it's very important that we understand the safety of the tower bar. The tower bar is known for its great versatility in facilitating movement, but it's also known because the power that's generated by the spring through this tower bar is tremendous. So it's very important that the therapist or the trainer not get in the way of the tower bar, thus decapitating themselves or dislodging their jaw against the wall. Very serious injuries can occur, and we want to make sure that we always practice safety. So one of the things that I like to do is when I put my patient's hands onto the bar, I always spot the bar with my hand, and I keep my head and face away from the bar. The first exercise I'm going to ask Jamie to do is just a very simple protraction, retraction of the scapulae around the thoracic cage. So basically she can just allow her hands to follow the pull of the springs in the bar up towards the ceiling and then draw them back down. So she's actually having a posterior glide of the humeral head on the fossa as well as the scapula itself sliding around the thoracic cage. So if you just notice right here, posterior glide and slide. From here we can go into elevation and depression. So we bring the bar over Jamie's head. Again, I'm still holding onto her hand and I'm holding onto the bar for safety reasons. And I'm going to ask her to elevate her shoulders towards her ears and then slide the scapula down towards the pelvis and the hips. Again, reaching up towards the ceiling, sliding down towards the pelvis. Let's just do one more of those and slide down. Now, the next variation we're going to do is actually having her sitting up. So we're going to bring the bar up over her head very carefully, and I can tell her she can now release. I'm holding onto the bar. I'm going to have her face you, grabbing onto the bar just slightly in front. And it's important that it's just slightly in front because if I move the hand too far back, what it does is it shoves the humeral head forward on that socket and once again creates that anterior subluxation. So that's not a good place to work. By having her bring her hand forward on the bar allows that head of that humerus to sit just right inside the glenoid fossa. So now we're going to concentrate on her drawing that elbow down towards the mat, keeping nice space around the neck and shoulders, repeating it 2 or 3 times. And again, just I can feel that she's in the right place. So you can adjust the hand based on where she can maintain that range of motion. So now I want to challenge her a little bit and see if she can still maintain the congruency with her hand back a little bit more in the coronal plane. That's right, beautiful. So again, the head is just in the right place, gliding on that glenoid fossa. The last thing I want to do is really looking at the scapular girdle by turning her hand over the top, hand here out straight, and we're going to try to get the scapula to rise up towards the ear and then press it back down and away, maintaining the humeral head in congruency with that scapula. So very common, people will do this exercise and they'll actually sublux anteriorly or posteriorly because they just don't know and they're not aware of it. So it's a great way to teach them how to be aware of moving through that shoulder. And relax, bend that elbow. So again, things to remember from this podcast: keep congruency inside that shoulder joint. Always looking to optimize that contact of the surface area between the humeral head and the scapula. We can use the Pilates exercise with the tower bar to help facilitate that. It's assistive in nature. We can do it in supine, we can do it in sitting, we can even create other variations that help do that. The most important thing is that you're always looking to make sure that you're not causing an anterior subluxation when you're doing the Pilates exercise, especially when you're carrying load, in particular with mat exercises, things like leg pull and leg pull front. Keeping this in mind, always practicing safety with the tower bar, you'll have a lot of success in restoring mobility in the shoulder and getting people back into their physical activities when they often thought that they couldn't return those activities. This assistance is a powerful, powerful tool. Bringing you a Balanced Body podcast from Polestar Pilates Center. This is Brent Anderson. Have a great day.